Hello, my name is Lena Cuthbertson. Along with my colleague, Rick Sawatzky, I am delighted to have the opportunity to showcase our efforts in the province of British Columbia in Canada to evaluate the quality and safety of our healthcare and services from what is arguably the most important perspective, the perspective of the people receiving or attempting to access our healthcare services. Today, our focus will be on our exciting efforts in British Columbia to advance the science of patient-centered measurement as a part of our partnership with the British Columbia Support Unit and the Canadian Institute for Health Research's Strategy for Patient-Oriented Research. Rick and I will cover how, as the patient-centered measurement methods cluster leads, we implemented a community-informed visioning process that led to the identification of 11 research priorities for patient-centered measurement methods with the goal of building on the existing foundation of patient-centered measurement in order to advance the science of patient-centered measurement. In order to set the context for this work in British Columbia, a few words about our provincial initiative that strives to measure what matters to the people who use healthcare services in British Columbia. We began this work in 2002, almost 2 decades ago, immediately following the major restructuring of our province's governance structure for healthcare. The new health authority structure was defined by the articulated goal of becoming a more patient-centered healthcare system. The key question was, who better to inform or to evaluate whether we had accomplished this goal of becoming a more patient and family-centered healthcare system than our patients. Our patient-centered measurement work continues to this day as a collaborative initiative of our Ministry of Health, all 7 of our health authorities, including our First Nations Health Authority and their affiliate organizations. Here is the mandate of our provincial patient-centered measurement work in British Columbia. We are tasked with implementing a coordinated, scientifically rigorous, cost-effective provincial initiative. Our deliverable is the collection of information such that it can be used to enhance performance monitoring and accountability at the system level, support local and cross-sector quality improvement and evaluation, and most recently and exciting is to inform research by providing patient records that are linkable to other clinical and administrative data sets for secondary analysis. Now over to Rick to provide a bit more context about how our work in British Columbia is situated within Canada's strategy for patient-oriented research. Rick?
Thank you, Lena, for setting the stage and for this introduction. Indeed, an important context of our work is the strategy for patient-oriented research, which is a national strategy by the Canadian Institutes for Health Information, where patient-oriented research is about engaging patients, their caregivers and families as partners throughout all aspects of the research process. This includes engagement, or this engagement helps to ensure that studies focus on patient-identified priorities, which ultimately lead to better patient outcomes. And so in British Columbia, this strategy is facilitated through the BC Support Unit, which stands for Support for People and Patient-Oriented Research and Trials. And as part of this national program to help healthcare research to be more relevant and meaningful to patients so that they get the best possible healthcare. As part of the BC Support Unit, we are leading a methods cluster that focuses on patient-centered measurement. There's actually 7 different methods clusters, as you can see on this slide over here. And so ours is specifically on advancing the science of patient-centered measurement from a patient-oriented research point of view. In the first stage, we sought to meet with stakeholders and interviewed people from several different countries to get to frame as to what we actually mean by patient-centered measurement. And we shared this with people throughout the province to get an understanding of that measurement is not just a technical matter, but it has to do with both data collection, obviously, but also with transforming that data into information and then making that information accessible and available through research and other activities to inform better care, better health, and better use of resources, and of course, ultimately better quality of life. We then took that definition and met with communities throughout British Columbia. British Columbia is a large province in Canada, and there is several different health regions and health authorities in the province, 7 health authorities. And we met in the context of each of those health authorities, where we had focus groups with patients, 74 patients in total, including, you can see some information here about the gender distribution. We had a variety of ethnic representation. We were intentional of sampling through for diversity, and of course, different age ranges as well. In total, we had over 10 hours of transcribed focus group discussions. We also held 7 workshops with stakeholders, and these included academics and analysts and clinicians, healthcare providers, researchers, and leaders, again, throughout the province. In total, 96 people joined. And again, we had some distribution, also distribution across different areas of expertise and different professions and different geographical locations. In total, we had 14 hours of transcribed interviews, and we then conducted a content analysis to arrive at what we believe to be a representation of key priorities for patient-centered measurement in British Columbia. In total, we arrived at 11 key priorities, and we'll now proceed with briefly describing each of those priorities.
Okay, so I'm going to start with theme number 1. Our first theme reflects the desire that we heard expressed by both patients and clinical and administrative users of patient-centered measurement data to develop measurement methods that reflect a shift away from patient-centered care to reflect instead measurement methods that focus on care that is patient-driven. So instead of care that patients view as being done to them, we are seeking to explore how measurement can be done with care providers. As Rick and I show, each of our 11 themes that arose from the visioning engagement exercise that Rick described, you will see that each slide includes an illustrative quote. For this theme, the slide shows a quote from a patient. I would like to also highlight another one that came as an aha moment from a clinical leader from our Interior Health Authority. This leader said, "How do we shift our focus from the outcome to assisting in the experience of what the patient is needing from us by really sitting down with our patients and finding out what's important to them and including that within our care plan instead of just being focused on the outcomes?"
The second theme has to do with giving voice to patients, family caregivers, and community stories. This theme reflects the need for measurement methods that integrate qualitative methods like narrative elicitation protocols with standardized measurement tools, including patient-reported outcome and experience measures. The focus is on learning from the stories of patients, family caregivers, cultural groups, or local communities, including Indigenous or other cultural groups or geographically defined communities. Please take a moment to look at the quote and the figure. We will not spend much time on each of the themes, but we know that you can pause the presentation to take in the quotes yourself.
Thanks, Rick. Okay, so theme number 3. This theme reflects the importance of feedback from patients about their feelings of fear, stigma, and vulnerability in the power relationships between patients, families, and care providers, both in the collection of patient-centered measurement data and in how the data could be used. This was a recurrent theme that we heard from patients and families across all ages, all genders, all ethnic groupings, all people with and without health literacy issues, and across our entire province. For me, this was the most disturbing of the themes that arose from our work. Examples include patient reports of feeling unsafe to provide direct feedback about their healthcare experiences and outcomes in real time for fear of retaliation, and in rural and remote regions where choice of care providers may be limited.
The next theme has to do with measurement tools that are individualized or tailored for diverse patients and populations. As you can see, there is some overlap between the themes, but this particular theme reflects the desire to develop and expand patient-centered measurement methods that address the value and purpose of personalized and or tailored tools and surveys.
This theme reflects the need for patient-centered measurement methods, sampling, data collection, analysis, that improve the representation of the experiences and perspectives of underrepresented patients, families, and cultural or local communities. Of course, this theme has some overlap with theme 3, ensuring that our patients feel safe to provide feedback, but takes us to another level in terms of those who are often not given or able to have their voices heard, and to better understand what methods and approaches will ensure that these individuals and populations are represented in our results that inform policy and clinical practice. And today you'll be hearing more about a project that fits under this theme.
Thanks. The 6th theme focuses on measuring across the journey of care. It reflects the need for methods and data collection and analysis that allow for patient experiences and outcomes to be measured across their journey, to be captured across their journey. A lot of our measurement focuses, of course, within different sectors, whereas this one focuses on tools and approaches that can be used across sectors of care.
Our 7th theme is called Indigenous Methodologies for Patient-Centered Measurement. This theme reflects our desire to work towards truth and reconciliation by learning about and improving patient-centered measurement through the lens of Indigenous methodologies. Today, you will hear from a project that was funded through our PCM Methods cluster in alignment with this theme.
The next theme is about improving use of PCM data for research, clinical evaluation, and administrative purposes. This theme focuses on the importance of developing effective knowledge translation strategies for patient-centered measurements, including education and guidelines for patients, healthcare providers, and decision makers on how to use patient-centered measurement data for different purposes, including research, clinical practice decisions of point of care, managerial decision-making, program evaluation, quality improvement, health policy, and health economics.
Theme number 9 was around integration of patient-reported data with other data sources such as clinical and administrative data. This theme was in response to the question of whether the contribution of patient-reported scores should carry equivalent, more, or less weight than clinical scores or administrative data. So this theme reflects interest in testing patient-centered measurement methods that integrate patient-reported data with clinical and administrative data for healthcare decision-making at the policy level, as well as for shared decision-making between providers, patients, and family in clinical practice.
Our second to last theme focuses on advancing methods for ensuring patient-centered measurement accurately reflects what's important to patients. And this is not just about what we measure, but it's also about what we do with the information. The theme reflects the importance of ensuring trustworthiness of patient-centered measurement data, as well as the accuracy of measures for representation of different patient experiences and perspectives.
And this is our final theme. It reflects a desire to leverage technology for the collection, the analysis, the reporting, and the use of patient-centered measurement data. As the quote on this slide indicates, the adoption of technology, while it has great potential for efficiency and cost effectiveness, we need to remember the human interface of technology needs to be considered and evaluated.
So based on these 11 themes, we reached out to the community and invited researchers, patients, and healthcare providers to join together to create projects that address each of these different themes. In total, we had 10 projects funded, and they are shown here. The themes are shown in the middle here, and the projects are on the outer circle.